Hi everyone, how are you? So we want to just continue with our animal envenomation series, and today we'll be looking at spider bites in Zimbabwe. So this is me, Professor Dexter Tagre, and I'll be taking you through this. I hope it's going to be pretty short. At most, I'm targeting 30 minutes, and then we should be done. So, so basically, by the end of this lesson, learners must be able to demonstrate an appreciation of the importance of a spider bite in Zimbabwe, to describe the two toxidromes associated with spider bites in Zimbabwe, including which spiders are responsible for them, and also to describe the management of spider bite in Zimbabwe. So, as way of introduction, there are over 30,000 known species of spiders worldwide, and almost all of them, except for one family, possess venom glands. And the venom is largely cytotoxic or it is neurotoxic. And from a Zimbabwean perspective or Southern Africa, if a spider is venomous and it's a web dweller, ordinarily would expect the venom to be neurotoxic, but we'll talk about this a bit later. And then the non-web dwellers would have cytotoxic venom. So with regards to the important genera of spiders in Zimbabwe, we've got three genera, which is the first one, the button spiders. So this is the genera Latrodectus. And then we've got what are called the long-legged sex spiders. And the genera, I hope I can pronounce it, it's Cairacanthium. And then we've got the violin spiders, which is Loxosceles genera. But as you shall see, there is a lot of debate concerning this second one, the long-legged sex spider. And I shall talk about it a bit later. But in addition to these three, we've also got spiders belonging to the crab spiders, which might also be of importance. But again, there isn't much literature, much data supporting them in terms of being serious medically. So we'll not really talk much about them in this presentation. Moving on, factors which are associated with spider bite. And just like you saw for scorpion sting and snake bite, farming activities are also quite important because, like for instance, the button spiders, especially the black widow spiders, would be veld spiders which are found out in the velds, in the fields, and that's where people would probably either carry them from the fields into the homes where bites will occur, or even bites can actually occur out there. And also with regards to sleeping habits, where the person sleeps, do they sleep on the floor, do they sleep on a bed, etc. And also the environment generally, is the home a tidy home? Is it an untidy home? What area is it? Is it a garage where you've got, the spider webs in different corners, etc. So the environment also contributes in terms of the risk of someone being bitten by a spider. And then about issues of endemicity or population of the spider species, but also of human beings. The types of spiders which are involved, you find that many spiders are quite reluctant to bite, which is a good thing. But there might be some. For instance, the long-legged sex spider for years has been said that it bites at the slightest provocation. So, spider type also becomes important. And then the time of day. Spiders, many of them are nocturnal hunters, and therefore would probably be more active at night, and people are bitten at night. As well as issues to do with habits, like the age, or children may be running around trying to catch spiders, molesting them, stressing them, and then being bitten, as well as other factors which I have not put in this particular presentation. With regards to severity, from your toxicology, introduction to toxicology, principles of toxicology, I think these things would make sense. And I will not dwell much, but we've got spider characteristics, and we've also got patient characteristics, which would then ultimately affect how severe a bite from a spider will be. And these are more or less the same type of characteristics that we mentioned when we were talking about snakes, as well as when we were talking about scorpion bite in Zimbabwe. And then just quickly, the parts of a spider, and I just included this because I'll be talking, I think, about the abdomen some way. And then the forward portion, that's the cephalothorax, which is normally the hard part. And then the chelicera, or chelicera, however you decide to pronounce it. This is where the fangs would be housed, and the fangs are the ones that then deliver the venom. And then the spinnerets, this is where the web, um, the silky, the web comes from, the web strands come from. So with regards to, we've got two major toxic syndromes. So the medically important spiders in Zimbabwe would either result in cytotoxicity, which is basically tissue damage, or they would result in neurotoxicity, which is, towards the nervous system. So let's start with the cytotoxic spiders. So in Zimbabwe, there are two genera of spiders which have cytotoxic venom. And the first one, of which with this particular one, there is no question about it. The violin spiders are well documented to cause serious cytotoxic envenomation. And I've put this one in red, the long-legged sex spiders, represented by this. The long-legged sex spiders for years were thought to also result in serious toxicity. But there's lots of debate on whether that is the case or not, and we shall talk about it when we get to long-legged sex spiders. Cytotoxicity would exhibit something like this, where you've got tissue damage, there might be scab formation or beneath it, and then ultimately there could be infection occurring, and sometimes there might be need actually for skin grafting in cases where the toxicity or the damage is, or the necrosis is quite extensive. Let's talk a bit about the first one, which is the violin spider. And these are average size spiders going up to 1.5 centimeters. They're normally golden yellow or reddish brown with contrasting darker markings. They have a round cephalothorax, okay, and a violin-shaped markings, and I'll show you in subsequent pictures. They are non-web dwellers and are free running. And remember what we said, non-web dwellers, then we're expecting the envenomation to be cytotoxic. They're nocturnal hunters, and they hide during the day under rocks and bark, and if disturbed, remain motionless. They occasionally do find their way in bedclothes, towels, shoes, etc., and are active throughout the year. However, these spiders are actually quite rare to come across, quite rare to come by, and therefore, bites from violin spiders are not as common as people would want us to be. So it's called a violin spider because if you look here, this will be the part where the strings of the violin are, and that's the bar of the violin. And it's not very clear here. Yeah, maybe a bit. The violin spider. So in terms of the toxicology and symptomatology of bites from the violin spider, most bites occur whilst people are sleeping or putting on their shoes or getting dressed. And the venom can cause extensive tissue damage, like I've always said, and it will appear that the damage is actually more extensive in the more fatty areas of the body, like bites to the buttocks and bites to the thighs. So I've put this one. Initially, the bite is painless, and this is what has been believed for years, but there seems to be recent evidence coming out that the bites from violin spiders might not be as painless as was said in the past and as was documented in past texts. But again, this is still a subject of debate, and scholars or students must be aware of what the discussions are out there in this area. So within 6 to 8 hours, there is a red, painful swelling with a purple center which develops just like a mosquito bite. And then over the next 2 days or so, the bite area progressively swells, becomes more painful, and a central black scab develops over the dead tissue, and there may be formation of pus under the scab. And then after about 10 days, dead tissue separates and then falls off, and there's a deep ulcerating a sore which may be even up to 10 centimeters in diameter, which is pretty big. I think you saw from one of the pictures that we had that the area of necrosis was actually quite extensive. So with regards to the management of violent spider bites, to start with, there is no antivenom which is available, and management is largely supportive and symptomatic. So you'd give analgesics for the pain. In terms of antihistamines, they've got no role to play in the management of poisoning or in the management of cytotoxicity as a result of violent spiders. You want to keep the bite site clean to avoid secondary infection because that can then really complicate things. And also anti-tetanus toxoid must be given. And if need be, antibiotic creams and powders can be used topically. And that's where you as a pharmacist would probably come in the dispensing of these. And oral antibiotics may be given also for systemic infection. And like I said earlier, disfiguring could necessitate skin grafting and plastic surgery. So bites from these violent spiders can be pretty nasty, actually. Moving on to the one which has been subject of debate even now, groups have been created where scholars, scientists, and other people are trying to come up with an answer as to whether these spiders do cause cytotoxicity, which is significant or not. And that's the long-legged sex spider. So they're pretty small to medium-sized spiders. The abdomen is longer than the cephalothorax. The legs are long and slender. And what makes them the characteristics of a long-legged sex spider is that the first pair of legs is actually much longer than the rest of the legs. And they've got black tips at the end of the legs. And then also another characteristic of the long-legged sex spider is the black face, where I'll show you from the picture which is coming, but the calyceria and then the area where the fangs are is normally much darker than the rest of the body. The body is quite compact, pale, straw yellow to greenish in color. And they also normally form a characteristic sac, which is a papery sac, a hideout or a place where they go in retreat, which is normally on curtains, on clothing, under windowsills, in door locks, etc. So it's a tough papery sac, quite difficult to remove, and that's where they normally retreat during the day. So they are free running, ground living, some may be plant living, and they are nocturnal hunters. And they're actually pretty aggressive and fast moving spiders. So you've seen it's the black face I was telling you about. And then you'd notice that the front legs are much longer than the rest of the legs, and then the elongated abdomen, which we were talking about earlier. I think here's a much better picture here. The black face, the elongated abdomen, and here we really can't see the two legs in the front, which are again the black face, very characteristic, and the pale color. Let's say a bit about the toxicology and symptomatology. So basically, from old texts and literature, even within the past decade, the symptomatology which has been described is quite similar to that of the violin spider. However, there's been lots of debate now because one of the components which is supposed to be the cytotoxic component in the venom does not appear to be present in the venom of Southern African long-legged sex spiders. And there's been a lot of debate, whereas in the past, most texts would say bites from the long-legged sex spider are largely painless. I think there's evidence arising even from anecdotal accounts from people who've been bitten by these spiders, that there's an immediate stinging pain, even more painful than that of a bee sting. But then, instead of having serious toxicity occurring, it appears that there's just mild pain and that there might be minimal swelling. But again, this is an area of great debate, which students should spend some time following up. And just following up and seeing how it goes. So the debate actually continues. with regards to the toxicity of the Southern African long-legged silk spider. With regards to management is largely the same as that of the violin spider, which we've talked about. The second set of spiders that cause significant toxicity in Zimbabwe, as well as Southern Africa, and these ones would be the neurotoxic button spiders or widow spiders. And I'm sure most of you have heard of the black widow spider. So the neurotoxic spiders belong to the genus Latrodectus, like we said earlier. And with these spiders, the female is the one that's responsible for most bites. The male is pretty small, and the fangs cannot actually penetrate human skin, but the females are slightly bigger. Actually, not slightly bigger, they're much bigger than the males. And the fangs can actually penetrate human skin, leading to neurotoxicity. So let's talk a little bit about this. So the button spiders are web-dwelling spiders, and remember what we said, they're web dwellers, and they bite you, and they cause medically significant signs and symptoms in Zimbabwe. Then we expect symptomatology to be towards the nervous system, they'll be neurotoxic. So they are web dwellers, and they make an untidy tunnel web, and they have characteristic egg cases or egg sacs, which distinguish the 4 important species in Zimbabwe. So we've got 4 species of button spiders in Zimbabwe. So we've got the black widow or black button spiders, and then we've got the brown button spiders. So the brown button spiders are the first 2 which are here. The brown button spider, latro, I left an R there, Latrodectus. Spelled wrongly here, so it's Latrodectus, correct that. Geometricus, which has got spiky egg cases, and we shall see the spiky egg cases. I think the previous slide did have them as well. And then we've got what's called the Zimbabwe button spider, which has got egg sacs much larger than these ones, and which are more woolly looking. But in terms of these 2 spiders, actually practically distinguishing them, as we shall see in the next slide, is pretty difficult. Although maybe if you do get an opportunity to look at the web and you look at the eggs, you might then be able to tell which is which. And then we've got the black button spiders, and there are 2 of them that we have in Zimbabwe. There's Latrodectus cinctus, which is found almost throughout Zimbabwe, and then we've got Latrodectus renovatus, which also is pretty, well, it's not here, but it's also widely spread. And of note here, Latrodectus indistinctus or marctans, which is the black widow that we see in the movies with a very, very potent venom, is not found in Zimbabwe, actually. And the black widows that we do have are these 2, which I have talked about, cinctus and renovatus. So these are generally non-aggressive spiders, and they try to escape or shame death instead of, biting someone or being aggressive. And normally bites would occur when someone presses them intentionally or otherwise. So now with button spiders, so they're small, dark spiders, which are up to 1 centimeter or so. The females, like I said earlier, are larger than the males and are also responsible for most bites. And they've got round abdomens. That's the round abdomen, as you can see. They have long legs, but the 3rd pair is the shortest. You can see there. The 3rd pair, as the 3rd pair is the shortest. So the famous black widow spider belongs to these spiders, called a black widow because the female spider eats its male partner, and others have attributed that black widow to deaths occurring in males during harvesting. Like I said, these are veiled spiders. And then we've also got the brown widows, and like I said, the Zimbabwean brown widow spider, and the brown widow spider itself are not really different when you look at them. So the brown button spider and the Zimbabwe button spider are not very different, quite characteristic dark joints here, and this lovely color. And then this would be the black widow spider. When they are younger, sometimes you do get, like either orange, reddish, yellow markings here in this type of spiders. Okay, and then this is, the male versus the female. As the male, look at how small the male is compared to the female. That's the reason why most bites will be from the female. Then in terms of the XX, we talked about this. The brown widow spider would have this spiky XX, and then the Zimbabwean brown widow spider, they'll be woolly. You wouldn't see these spikes. Then one of the smooth one, this would be, the black widow spider. So that's a black widow spider XX. So in terms of the toxicology and symptomatology, like I said earlier, these spiders will only bite if they are pressed. And they have a neurotoxic venom which leads to destabilization of cell membranes and degranulation at nerve endings, leading to a release of neurotransmitters. And here we're talking about both. We're talking about both, acetylcholine as well as epinephrine. So the venom is considered one of the most potent biological toxins, but this would be largely for the distinctors species. But the black widow spiders, generally they've got venom which is pretty potent, and the wound is small, maybe swollen, and at the bite side there's normally pain. And then just going a bit more into what to expect if someone actually suffers from what's called latrodectism, which is envenomation by the widow spiders. So there's a sharp burning pain at the bite side. At the bite site, and it spreads to the lymph nodes, which are in the area within 15 minutes. And one of the characteristic signs, symptoms of button spider bites is the severe muscle cramps and pain in less than an hour, which leads to tightness of the chest and difficulty in walking, and abdominal pain may actually occur. So others have actually described this abdominal pain and abdominal cramps as board-like, where the abdominal muscles really tense up as though somebody's got a board, in their stomach. And then there is anxiety, slurred speech, and headaches, which have also been described. There can be breathing difficulties and heart palpitations, nausea and vomiting, sweating and excessive salivation, and watery eyes. And in fact, even still at the face, the face also has been documented to swell up and be a bit puffy. The body temperature could either fall or rise above normal. Blood pressure may rise with an increased pulse rate, and a rash may actually develop. And an interesting phenomenon is that there may be erection in children, and I think we also mentioned something like this when we talked about scorpion sting. So here is classical symptoms with the sweating, the flushing of the skin, the face is puffy. So that's what you'd get with the buttons. So in terms of management, at least for this one, there is an antivenom which is actually available from the South African Institute of Medical Research. So if no symptoms are available, if no symptoms present, just cleaning the wound and treating that septum may be enough. But if symptoms develop within the first 24 hours, then medical treatment becomes extremely essential, and it is supportive, looking at all the major systems that we talked about. With analgesia, and analgesia here, you want to stay away from your opioids, which may actually make the respiratory depression even become more pronounced. And also, like I said earlier, the role of antihistamines is still very largely debatable, but an antivenom is available. And many cases where people were bitten by these spiders, antivenom was actually found to reverse significantly the symptoms of um, bites from the widow spiders, and here to be largely the black widow spider. So, like I said, so the venom of the black widow is about 4 times more potent than that of the brown widow. So it means even if someone is bitten by a brown widow spider, um, they might exhibit some of the symptoms that we mentioned before, but maybe not to a similar extent as a black widow spider. And I just want to finish off, well, not really finish off, by having the illustrative case of a black widow spider bite in Johannesburg. A good case which was reported by Teresa Thomas and colleagues, and it was published in the Southern African Journal of Infectious Disease. So it talks about a 38-year-old presented to a hospital with a history of being bitten by a spider in the early hours of that morning. He reported feeling a stinging pain. Do you see that? Remember, we talked about pain at the bite site, stinging pain on his abdomen at around 6 a.m. and immediately investigated the site, and he caught a black spider, which he brought to the hospital. The spider was then identified as a female black widow spider, Latrodectus indistinctus. And remember, we do not have this actual species in Zimbabwe. We've got the other two that we mentioned. This is the spider that was brought, the black widow spider. So you'd find that as they grow, like the older ones, sometimes there's a bit of red here, close to the spinnerets. Um, yeah, and in Africa or in Zimbabwe, if you had a black spider with an hourglass, beneath it, it's then would be most likely to be a brown widow spider as opposed to a black widow spider. But that's the story for another day. So he was flushed, was sweaty and anxious. Inspection revealed erythematous area on the right lower quadrant of his abdomen, which was thought to be the bite mark. His blood pressure, temperature, neurological state remained stable throughout his admission. And then we've got the blood investigations being put out there. They did a toxicology screen and blood. So treatment was with intravenous fluids and calcium gluconate. This is something which I wanted to mention with regards to calcium gluconate, or the use of calcium. That calcium can be used to actually combat the muscle cramps, which occur as a result of the venom of the black widow spider. They give analgesia in the form of opioids, although it's not really recommended, especially if there are signs of respiratory distress, and they non-steroidal anti-inflammatory drugs as well. They had a short course of corticosteroids and antihistamines, whose role really is still debatable, and there's no evidence that these are of any benefit, and they do actually write this here. Anti-tetanus toxoid was administered as we expected. We mentioned it earlier for a spider bite, and antivenom was sourced in consultation with an entomologist, but was not administered for 2 reasons. One, the patient did not display any signs of danger. Yeah, and he did display signs of danger such as hypertensive agency, emergency, shock, pain, refractory to analgesia, and did report allergies to sulfur and penicillin. So because they were concerned about these allergies, and he recovered in hospital the next few days with symptoms abating daily and was discharged home a week later. On follow-up, a year later, the patient was fine. So that's just a good illustrative case, which I thought would then, bring out some of the signs and symptoms that we talked about, and then I would spend a bit of time highlighting some of the management issues. And then just to finish off, it would not be complete if we did not talk about precautions or prevention of spider bite. So generally for button spiders, it's a good idea to keep your houses clear of rubble, as well as your outdwellings clear of tins of leaf litter, because the brown widow spiders do actually have webs which are close to the homes. And if you do get some webs with egg cases or egg sacs, it might be a good idea just to destroy those webs and egg cases. If you are traveling, you're traveling out, you're camping elsewhere, it's always a good idea to shake your clothes off and your shoes, check them off before putting them on. And this is also quite useful for scorpion sting as well. And also, you might want to inspect your bedding before going to bed, especially if you are in areas where the spiders might be, um, you know, going out camping, or in some areas which I've just put as suspect environments. It's a good idea not to play with the spiders, to molest them, to press them, because then they can bite you. So yeah, that's the presentation on spider bite. I do not expect students to so much have an idea. And those were your references. Otherwise, thank you so much. God bless you. I hope you got something from this. All right. Goodbye.